Hi everyone. In this mini lecture, we're going to take a pragmatic approach to looking at the barriers to the implementation of outcome measures. Once you've chosen your outcome measure to be implemented in your own clinic, a lot of times there are a lot of logistical as well as personal and administrative barriers to the implementation of these outcome measures. So we'll look at some of them and then perhaps look at some solutions. Hopefully this lecture will give you some inspiration into guiding you in your last summative assignment on how to produce that assignment. In this mini lecture, there are three things that we're going to look at. Firstly, we'll be looking at the types of barriers for implementation of outcome measures. And then we're going to consider some barrier busting steps to see how we can overcome some of these barriers and enact a slightly smoother implementation of the outcome measures. And then we'll also look at some tips for implementation, things that we know from previous experiences of people implementing outcome measures that might be interesting and fruitful to pursue. Before we do any of the mini lecture contents, let's go to a scenario first. So let's say you've been asked to organize and coordinate an outing for the entire class. So the very first thing to do is have a think what you're going to do in order to organize the outing, in order for the outing to be successful. Here are some potential steps that you might have thought that you will be doing in order to organize the outing. Firstly, you might find out what everyone's budget is in order to know exactly where to go. And then you might find out when is everyone available, because you don't want to leave anyone out. You might want to then consider looking at various locations and then putting it forward to all your classmates in order to choose a location that most of us would be agreeable to attend. And then to find out if the location is actually available for the time that you want to go for your outing. Next, once you organize all that, you need to then inform everyone of the location and time. And then lastly, organize yourselves and other people to be at the place itself in order to enjoy the outing. Now you can see that it takes several steps in order for it to be successful. And with anything, as you will probably have experienced yourself, it is probable that there is a likelihood of something going wrong at some step on the way. And here are some things that can go wrong. It could be that not everyone has a large enough budget, so therefore you can't go to that swanky restaurant that you've always been wanting to go. Or some people might be on leave or has work and therefore won't be able to make it on certain days and times. Or the location that you have chosen is simply too busy that on the day that all of you have agreed to be able to be available to attend, the location won't be allowing you to make a reservation, and so on and so forth. As you can see, there's potential steps that could go very wrong indeed. Now, the implementation of outcome measures is quite similar to how you organize an outing. There is a host of barriers that can actually obstruct your implementation. Therefore, it is always good to firstly identify the barriers in order to be able to problem solve and forecast what are some solutions that you might be able to implement in order to overcome some of these barriers, as well as speak to other people who might have gone through the implementation of outcome measures and then learn from their experiences. So the first question you ask is, where do I start? How do I actually identify all these barriers? Well, interestingly, if you look at some of the research surrounding how clinical teams as well as clinicians have implemented outcome measures in their own practice settings, some common themes emerge despite the fact that different areas of practice settings, from respiratory care to palliative care to primary care setting, they have all actually had common themes emerge when these groups of clinicians tried to implement a outcome measure. And we will look at some of common barriers and then classify them into common categories. So these are the three common barriers. Firstly, it's clinician-related. Secondly, it could be patient when they're interacting with the outcome measure related. Or thirdly, it could be due to resources and organization related. Now, the first barrier is clinician related. Now, there are many things that can obstruct and form a barrier into implementation of outcome measures. Clinician could be yourself, or you could be your colleagues, and a lot of time it could be due to the lack of understanding of what is being asked of them. But there are many different reasons why clinicians could be a barrier to implementation of outcome measures. And if you like more details, what you can do is look at the textbook of Riddle and Stratford, and they will have outlined and explained in more detail some of the common barriers for clinician-related ones. I've also uploaded some research papers. It's worth looking through them in order to get some idea of some of the common themes that emerge which are clinician related to the barriers to implementation of outcome measures. Now, the next group of barriers is patient outcome measure interaction. There are several things that could obstruct the implementation of outcome measure. Firstly, sometimes some of the outcome measures that were chosen could be a very long questionnaire, and therefore that can be a considerable burden on the patient in order to fill that in. Or the language being used within outcome measures is too difficult. A lot of times questionnaires are being designed by scientists or researchers that has not actually taken into account the reading level of the patients who might be using them. So these are just some of the interactions. Again, Riddle and Stratford textbook will have outlines and some of the details, as well as look at the research papers I've uploaded to the hub, download them and have a read. The third barrier is related to resources and organization. Now, a lot of times there are many reasons in terms of resources and organization wise matters that may prohibit or obstruct you from implementing an outcome measure. The very first thing is that there could be not enough money, so therefore the questionnaires cannot be bought. Of course, one way around it is to actually look for similar questionnaires that may address the issues and requirements of your clinic, but yet is available free without any copyright issues. Now, sometimes the measure may not be readily accessible when you need them. Now, this just requires a bit of planning. So what you need to do is that always have extra copies of the measures ready in the clinic at appropriate times in the clinics that you reassess patients in order to be able to use the measure. Or perhaps you could implement it as a standardized protocol where every single patient that comes through your clinic will have to answer this particular or use this particular outcome measure, and it's always in all the files of your patients. So these are just some suggestions that could make life slightly easier in terms of the resource and organization related barriers. Again, for more details, read Riddle and Stratford textbook as well as the research papers that are uploaded to the hub. Now that we've identified some major categories of the barriers to the implementation of outcome measures, what are some steps to help us to remove these barriers? Step 1. You need to declare the aim of using a measure. Without a specific aim, you would be quite muddled as to why you chosen this outcome measure in the first place. By having a very explicit description of the aim of why you're using in terms of the patient population as well as what type of outcome measure you are, this will help you be more focused in the choice of what you're trying to implement. Step 2. Always state important patient-related constraints. If there's any barrier relating to the patient, always say it out so that you can actually plan ahead and then implement steps to overcome these. Third step. Always state important clinical setting constraints as well. What are some things within your clinic that will prevent you from implementing the outcome measures? It could be you, it could be your colleagues, it could be resources, it could be anything, but the very first step of actually stating it out will help you to be able to identify it and then put in solutions to address these. Step 4. Implement an effective and efficient search for relevant outcome measures. What you need to do is have the skills to be able to search for the outcome measures, and some of the search skills that you've learned within this program as well as this module will help you search for the outcome measure more efficiently. Step 5. Seek out measures that has information for score interpretation. It is absolutely useless to choose an outcome measure when you do not know how to score the particular outcome measure, as well as to interpret the outcome measure in order for you to have a clinical meaning for your own patients. So always remember to choose outcome measures that you do understand and know how the data will then help you to plan and goal set for your patients. Step 6. Scrutinize measurement properties relevant to the clinical context. Within this module, we've looked at validity, reliability, as well as responsiveness of the different outcome measures. So what you need to do is apply some of these skills to look at the properties to see whether that particular outcome measure is fairly robust in order for the use in your own practice settings. During the implementation itself, it's always good to involve the administrative staff if you are in a larger department. The reason for that is because the entire clinic runs not just with you as the main person, but the entire clinic runs smoothly because of different staff contributing to different areas. Because you're implementing an outcome measure, sometimes having administrative staff involved in the implementation will help you identify some of these logistics as well as process related barriers, and it will make life so much easier if you have the administrative staff on board to help you with it as well. Consider some administrative time savers. Are you able to ask the patients to fill in the outcome measures if it's in the form of questionnaire at home or just before they come to you in the clinic, so that you are able to then just simply collate the scores once the patient sees you face to face? And also set up efficient systems for readily accessing resources. If you are going to use a particular questionnaire quite often, always have a pile of them ready in the corner of the room or the clinic in order for you to be able to just walk over and have a copy itself. So let's summarize some of the things that we've done for this mini lecture. Firstly, we've identified some common barriers. Interestingly, common barriers that occur across practice settings. Secondly, we've looked at some of the steps we can do to overcome some of these barriers. Essentially, what we are trying to say is that you should always plan ahead in order to see what these barriers are so that you can put in appropriate solutions. When you've done all that, then it's just a matter of trying to implement the outcome measure within your clinic and re-evaluating it. I hope that this mini lecture will give you some ideas on how to identify as well as resolve some barriers to implementation of outcome measures.